little urinalysis booklets, because, you know, that's a good little quick review. Okay. We'll just kind of go around the horn, and if you don't know it, then we'll go to the one who follows you. Instead of being in teams, we'll just do that. And, oh, I do want to run back and get my test. My little folder of tests. Sodium chloride. Chloride is active in the ascending. Sodium is active in the proximal and distal. Water, we just said everywhere but the ascending. So I would give you even credit if you put it in the distal. Urea is in the proximal passively and ascending. Sodium is passively in ascending. So I would re-study that. Okay, so, and how I would study first, I would go through all 6 tests, or 7 with a little take home on the fecal and that's added. And I would start with 1, because that's the furthest removed. Okay, so you know you're gonna have to go over your dipstick. Can you, well, I guess we'll just throw it out here and see what you guys remember of anything. I know, y'all are brain dead right now. On collection, I'm getting a 24-hour urine. Someone explain it to me. We'll start with, okay, get rid of the first one. And then do I just,
subsequent ones.
what do I put it in, little cups everywhere?
They'll usually
Yeah.
do a large container to put all this.
They'll give you a kind of like a milk jug orange thing.
They can be refrigerated.
And at least refrigerate it. They should have some kind of card file in chemistry on if it's certain they want to do a 24-hour on something like calcium that you might need to add boric acid or you may need to. Usually we kept a little thing that told us what we had to put in the container. But at minimum, 2 of the most common ones you're going to get are protein and creatinine. And at minimum, you know you got to put it in the refrigerator. Then what did you do with the last urine?
Discard
You
it.
still save it as
Keep
well.
Keep it. Okay. Then when you test it, you just pour some out and test it.
No, you wanna.
No, you shake it up really good, mix it up really good.
And you test an aliquot. What if you're above the, what if you have 2 big containers?
You have to mix them.
We had a bucket we kept under the sink that we had to just clean out, and we mix it in there and take our you know, like a jar, whatever, we had these kind of, looked like an Erlenmeyer flask, but it was plastic with a cap. You know, they'll have something. Tell me I am getting, Leah, I'm getting a clean catch. Tell me what I do.
You have to get the little white, you know, the labias or the head of the penis, and then they go midstream in a sterile container.
Okay? And what is always your best
First
time?
morning.
If you can, first morning. And then you can, what happens if you don't test it within an hour and you let it sit indefinitely at room temp?
What I'm doing right now. Throw it away.
Not necessarily. Some labs are not gonna be as strict about that. So what would you expect as a tech to happen to that urine?
The results may be a little inaccurate.
So what happens to the bilirubin?
The light is
Okay, Nicole, what happens to something else?
Bacteria, nitrates could increase.
Well, nitrate, well,
Or,
nitrate's not necessarily if it's gram positive,
yeah.
but the bacteria
For gram
will
negative.
increase. So Tiana, what about the cells? What will they do?
Oh, the red blood cells will ice.
Well, they should at least start deteriorating if it's any cell or cast. And then, Katie, what will happen to ketones if they're present?
They evaporate.
Okay?
Doesn't glucose decrease because of the bacteria?
Oh, glucose will decrease because of the bacteria. Yes, that eat it up. So, whoa. What are 2 kinds of assisted collections that you weren't, someone would have to do it to the patient?
Like catheterization.
Catheterization, or maybe sometimes they do another one.
It's the.
Suprapubic?
Yeah.
Suprapubic.
The one where you stick a needle in.
Yep, through the bladder. What are three main things in urine? What are three key waste products?
Urea,
Urea.
water,
Uric
Ammonia.
acid, creatinine. I would say your main, well, those are your three main ones. There's lots of salts or other analytes, but your three main ones are probably gonna be urea, creatinine, and uric acid. And what are two that you assess kidney function with in chemistry? Urea, blood urea, nitrogen, and creatinine. I think you're okay with labeling properly. So, tell me, what do you do, Amanda, on the physical analysis of a urine?
You look at the color and the
Color.
clarity,
And what would be an abnormal color that you worry about?
like an amber or
Yep.
dark.
On a fresh urine, the first thing I would think of would be liver, like hepatitis, on an amber that was fresh. Now, would you automatically worry if it was a bloody urine?
Not
No.
necessarily.
Depends on
it's a woman.
female menstruating years, you might get that. But if it's a male and it's bloody, or you know they've maybe just had some trauma, like a car accident or something, and it's bloody, that could be from damage. Okay, so tell me if it's red clear versus red cloudy, what it could mean. And I have a positive blood on my dipstick. Full, yeah, they're intact, not lysed. And then what would clear be? Hemoglobin or myoglobin. So where are you gonna confirm the cloudy? Under the microscope. And then where are you gonna, what test confirms the myoglobin or hemoglobin? Begins with an A, S.
Acetase.
Ammonium sulfate. Okay, so tell me, what would you see positive if I had a cystitis? On the dipstick and on the microscopic. It's a bladder infection. So what do you, if I have an infection, what do you
Possible
think you're gonna see?
bacteria.
Nitrites always?
And leukocytes.
Nitrites always?
No.
If it's a
Not all-
gram
if it's gram
positive,
positive,
they
it's
don't
not.
convert nitrates to nitrite. But what would always be there, or should be there? The white cells. And we're talking at least greater than 5. We had a rule of thumb greater than 8 that we worried that they had a UTI. And what else? So you have white cells and bacteria for sure. If you have, because you don't have to have a positive nitrite to still have bacteria and have a UTI. Then what is the difference if you had pyelonephritis when you're doing the microscopic? What's the key feature of pyelonephritis when it's the actual kidney infection? Not just white cells, but white cell cast. Okay? What can acute glomerulonephritis follow? What kind of infection commonly where the glomerulus gets damaged? Strep. And what is a key feature that you see with people who have acute glomerulonephritis? Protein can be with anything. UTI, anytime there's cast, anytime there's bacteria, anytime there's cells, you can have protein. High protein, they're always gonna worry about maybe something with kidney. But the classic feature, if pyelonephritis is white cell cast, acute glomerulonephritis is red cell cast. Okay? Then tell me if I had nephrotic syndrome, where they have problems with my lipids and losing protein, what kind of cast are, what kind of cells under the microscopic are diagnostic for nephrotic syndrome? Oval fat bodies, which are what kind of cell that traps fat? Renal epithelial cells that trap fat. And then you might have fatty cast, and if they use a polarized light, you might see the Maltese crosses. So nephrotic syndrome, those are classic features. If you only know that, you should get it right on the registry even. Those are two classic features, fatty cast and oval fat bodies. What if I have chronic glomerulonephritis versus renal failure? What kind of cast are you gonna start seeing, and who has the worst GFR or creatinine clearance? Waxy or broad, depending on what your lab calls. If the renal failure is gonna have less than 25 GFR. What is gonna happen on the chemistry side? And who has it worse? Even in creatinine, who has it worse? The renal failure is gonna have, they're not clearing their waste products, so instead of being 1, you might have a 5 creatinine. Instead of being 20, you might have a 95 BUN. What is, the Hansel stain for? Interstitial nephritis, what are they gonna use the Hansel stain for, to stain what kind of white cell that might be present? Eosinophil, and they use the Hansel stain. What are the 4 confirmatory tests normally, which I don't know if any of you will get to see anything but a ClinTest maybe. What are the 4 chemical ones that you do with another chemical test? I'm sorry. Glucose what? ClinTest. Ictotest for bilirubin, ketones, acid test, and then what are 2 Roberts or what? There's another one you could do for protein.
Salicylic acid.
3% sulfosalicylic acid. And they use an acid that will precipitate out the protein. When the Roberts, you look for that milk line. We put the back of the bottle up and see if it was positive. Tell me, how do you confirm a urobilinogen, whether it's urobilinogen or porphobilinogen? What test can detect both?
Grease.
That gives a W.
Watson.
Watson, Schwartz, and then which one only detects porphobilinogen? The Hesh. And, tell me on the difference just on your dipstick of diabetes insipidus versus mellitus, just on the dipstick so far.
Glucose.
Really low.
Both it has, the insipidus has the low, because it doesn't have ADH enough of it to pull back the water. So it goes out and makes a very dilute urine. Polyuria, you're going out because you're spilling so much sugar, it's trying to dilute out the glucose. So it has a high specific gravity and your glucose and probably ketones. Tell me the difference when using the osmolarity, which we know is better than specific gravity, because why? It measured, what has more bearing on your osmolarity? The number of particles, like sodium chloride would be 2 per molecule versus the weight, like in specific gravity where glucose is so heavy, it would be the issue. So do you remember what specific gravity is greater than 800 with the neurogenic versus nephrogenic diabetes insipidus? One, it doesn't produce ADH, the neurogenic, so if you inject them with ADH, it's gonna be the 3-to-1 urine to serum osmol, so it'd be greater than 800. Normally serum's about 300. Nephrogenic, the kidney's the problem, so they don't care if you inject it with ADH, it can't make more solutes in the urine, so it's less than 400. You gotta know that. I've given you a handout on that. So you need to know which one is higher osmo versus the other. Let's go through your reactions. What's your reaction for pH?
Bromothal blue.
Methyl red or bromothiamyl blue. Protein is, they call it the protein error of indicators, and one of the indicators is tetrabromophenols blue. Glucose, I just usually put oxidase on the test, but it's glucose oxidase. Ketones, it's the nitroprusside. Bilirubin, the diazo. Urobilinogen, the Airlix. Nitrite is grease, G-R-I-E-S-S. And leukocyte is esterases, I think they say leukocyte esterases. And then the specific gravity, they say polyelectrolyte of pKa, or pKa change of the polyelectrolyte. So that will be a matching. Tell me what amino acid is the most amino aciduria is the most common. Mousy smell to the urine. It uses a test called the Guthrie test. PKU, it's missing phenylalanine hydroxylase. And does the Bacillus subtilis grow or not grow when you have PKU? It grows because all the phenylpyruvic acid that builds up. What what pathway is that? Tyrosine, phenylalanine tyrosine pathway. What two the urine darkens upon standing? Melanuria and alkaptonuria, which is a missing homogentic oxidase. What two go with the tryptophan pathway? One has the blue baby diaper syndrome. It's called, begins with an H. Hartnupp's disease. And which one in the tryptophan is the other other cancer? IAA, that argentefin cells of the pancreas is a cancer. So you have melanuria, that's a cancer, and the 5-HIAA, because you have melanoma with that one. Which one is the only amino aciduria we talked about that the kidney is a problem, not that they have a genetic defect in the amino acid enzyme? Cystinuria. And what may you see in the urine? Cystine crystals, and it may cause renal calculi or a kidney stone. What are the 3 mucopolysaccharides that affect your connective tissue? 2 H's and an S. And Sanfilippo. And then tell me if I have a carbohydrate other than glucose, that's the problem. What do you see on your urine? And they're under 2 years old. Clinic test, because it does other sugars, whereas the dipstick's only glucose. And what is the disease that, it's not an amino acid, but it is, they call it a purine disorder, and it has buildup of the uric acid. It's called, begin with an L and an N. Leishman. And tell me when you might suspect a porphyria. Red urine, that's the classic thing they give you even in the registry book. And then what is the most common cause? Your heme, the formation of heme is messed up at one of the steps, and one of the common one is maybe paint chips in a poor area. Lead poisoning, okay? Tell me, on your body fluids, what is your most stat? Which one? And tell me everything you might want to do on a spinal fluid.
Glucose, crystals.
So glucose in chemistry, glucose and protein in chemistry. cell count in heme.
Crystals in
Crystals, not on spinal fluid. So
Gram stain and micro.
gram stain and plate it, and then what might you do in serology, like Katie will get to do this? Bacterial antigen panel, so name me them. Neisseria meningitidis, AC and Y. Neisseria meningitidis B with E. coli, those are two. Then they have Haemophilus influenza, Streptococcus pneumoniae, strep pneumo, and group B strep. So Staph aureus is a culprit, it's just not on that bacterial antigen panel. But tell me where the tubes go, what department? If you only collected 3, where do they go? First one to Kim, second one to micro, third one to heme. Third one's heme. That's okay. With this, I'm just trying to stir up the whatever, mothballs or whatever in your brain.
Get those spider webs out.
What'd you say?
So get those spider webs out.
Yeah, well, it's a lot of material. You guys have worked wonderfully, and I appreciate your effort. So I know it's a lot, but you have been troopers. Tell me, what is the most common white cell you see? Well, what's the normal white cell on adults versus a newborn? Because since a lot of people missed it, and I had to give it as a bonus. What is the normal in adult is the lymphocyte. What is the most common one in a newborn is the monocyte. What is the most one associated with? So on that synovial fluid, what was that person's problem probably? What group? That was a great one. Septic. I mean, there was easily probably gonna be 95%, over 90% neutrophils. Yes.
You said a goat is lymphocytes?
Yep.
and newborn-
Common on newborns. Who has the highest normal that is considered okay? The newborn can be up to 30 white cells. It shocks me. We're not supposed to have any, really. And then what would be the clue that it might be bacterial? Give me 2 things that you would know would be bacterial meningitis.
Low glucose.
Glucose eaten up by the bacteria.
Increase.
Maybe increased protein, not time,
And then
protein.
neutrophils?
Neutrophils. And then what would be the key piece with viral meningitis?
Low glucose.
And viral, they can have a high protein as well, but the key cell is gonna be the lymphocyte. And then, glucose is normal in the viral. And what would be the fungus associated commonly that you might get to do a serology test for it when you go out in your clinical?
Cryptococcus.
Cryptococcus neoformans, and they stain it usually to show the capsule with India ink. And tell me everything that would suggest it's a subarachnoid hemorrhage.
Sinusoid.
Now tell me about the tubes first.
Oh, all blood.
Equal red, okay? Then 3 things under the microscope.
The macrophage.
Xanthochromia can be one for red cell degradation. Did you say what's your first one, the erythrophage? Hemosiderin or siderocyte that has the iron precipitate. And then what's the gold body crystal that is associated to? The hematin or hematoidin body. And
Erythrophage? Is that one too?
what one?
Erythrophage?
Yep, because it's ingesting red cells that are there, that are present from the hemorrhage. And tell me, what are the lining cells called in the CSF? So if you get one on your slide test tomorrow, you call it ependymal or choroid plexus and it's okay. If it's in serous, then you would call them mesothelial. And remember, when you're out there, try to go with your macrophage being big and bubbly. And you're not going to hurt someone if you call more, if they're smaller in size, like a mono, they're still of the same family. One's more in the blood, one in the tissues, becomes the macrophage. So tell me what's the term when it is a fluid buildup in the serous fluids? It's called an effusion. So tell me the two types of serous fluid effusions. One, transudate, exudate. Who is the systemic one? Transudate. Who is more like a malignancy or an infection of that particular area? Okay, so if you see malignant cells, that's the problem. They have a cancer or something on that area. If you're on your diff, you see immature cells flag, that's your biggest problem. So tell me, how do I know if it's a transudate or exudate by my testing?
The ratio.
That
Of
L
6.5 or 0.5.
less than 0.5 we'll just go with is the transudate, greater than 0.5 is the exudate. And what's the other one besides LD? You have total protein. So they can give you the serum of that patient's total protein or LD and the fluid. And if it's less than 5, that points to a transudate. Greater than 5, it points to an exudate. What about another thing? What about looking at the fluid?
White cell count.
Well, white cell count, we're just gonna say less than 1,000 or greater than 1,000. We're gonna just keep it that way.
Exudates will be more cloudy.
It's cloudy. And transudates are usually more clear. So congestive heart failure, a lot of times that's gonna be a common one you're gonna run into with a positive of serous fluid that an effusion that builds up. Malignancy or an infection are the common exudates. What about synovial? That one, you're supposed to take the volume compared to others, but what is the difficulty of a synovial fluid? So it has the hyaluronic acid or hyaluronate that gives it the viscosity, so you've got to add hyaluronidase to make it more liquefied. And what are the 4 groups? Give me a disease state, 5 groups. Give me a disease state associated with all 5 groups. 1 is non-inflammatory, and it's what? Degenerative arthritis. 2 is inflammatory, and 2 autoimmune disorders are common. RF, or rheumatoid arthritis, and lupus. And 3 is what you would have had over there. Septic, bacterial or septic with over 90% neutrophils. And then 4 is, and it'll have a high white count too, but what is the key flag? Crystals, and what is the crystal with gout?
Pyro.
Urates, and calcium pyrophosphate is with pseudogout. And then 5 has the most blood because it's related to some kind of trauma or mechanical injury to the joint. Tell me on a semen, what are the 3 common tests done on a semen? Fertility. What's the second one? Post-vasectomy. And then 3rd, the sperm washing. What is the problem on the fertility testing that you would want to do a sperm washing? What test is abnormal? The motility. It's not greater than 50% with good forward motion after 3 hours. That should tell the doctor, order a sperm washing and let's clean it up and get it free. Then what's the pH? 2 to 7.8, and usually the low pH is when it won't be able to fertilize the egg as well. What is the normal count? 20 to 160 million. And the motility, at least if it's at least 50% motile with the good progression, like it is coming straight at you, not just sitting there vibrating and not going anywhere. And what is normal on the diff? What are you allowed? How much percentage of abnormal forms? 30%. So you could have head, tail, mid-piece defects. But if it's not greater than 30%, that's not the problem. They have plenty to fertilize the egg. So Tell me on the amniotic fluid, I'm worried about the baby being mature enough, lungs.
Greater than 10?
What is the two tests commonly done?
Creatinine.
The ratio. Creatinine greater than 2 is one choice. I don't think that's always the one they rely on always. LS, lecithin over sphingomyelin. Lecithin is greater after like 35 weeks, sphingomyelin after 26. Which one parallels lecithin in being higher after 35? The phosphatidylglycerol. But the LS ratio, if you divide the sphingomyelin into the lecithin, if it's greater than 2, they say they're mature. And a lot of people miss this one. How many lamellar bodies show that the lungs are mature? Greater than 35,000 I had in the PowerPoint. I think it says 50,000 in the book between such and, but I had greater than 35,000.
Is that the test that is really gonna be the most common?
I bet the lamellar bodies, because I think you can do it on, it's the size of a platelet, and you can do it on like a Sysmex. So I bet you'll get to see the lamellar bodies. I think St. E's, they're doing the lamellar bodies, so that's pretty cool. What is the bilirubin for? Why would you do the bilirubin test on an amniotic fluid? Hemolytic disease of the newborn. And which hypersensitivity was it in serology the other day? You had one was HTN and you had one that was RF and ANA. When Diane was going over hypersensitivities. I think 2 is HTN and 3 is the RF and lupus hypersensitivities. And the 4th one was with the T cells, so it was contact dermatitis. And the first one was your typical poison ivy and bee stings and all that. I think the first one was bee stings and food allergies. 4th was the T cell involvement. So those are in your hypersensitivities and in your serology book. You should know them. What is done for neural tube disorders? What test? When, like the guy I told you about in the marathon, whose back they had to, the spine was born outside and they had to close it up and he couldn't walk. And he wanted, so the alpha fetoprotein. Fecal, what's the most common test done on fecal? Cold blood, what is the method name? And what is the indicator?
Blue.
Pseudoperoxidase demonstrates the blue. And why do you use a test that is less sensitive? A blood that we all might have. And colorectal cancer is its biggest clue, but if it's at the lower end, like from hemorrhoids or any kind of, well, ulcer should be some higher where it would be black and tarry, but its classic disease is colorectal. And then what else can you do? Which one, what's the term when you're doing, what test on stool do you do for the pancreatic insufficiency? And they call it steatorrhea. Fecal fat. And what is one stain you use to show them that you used in urine to show the oval fat bodies and the fatty cast? The oil red. They even have a Sudan 3 and 4 in the book as well. And then you can also do the muscle fibers, like with cystic fibrosis. But the common one is going to be your cold blood. I've never done a fecal fat in my whole career. So I don't know if any of you will get exposed to some of the other stuff unless you get to work at a reference lab. Okay, so I think, so first of all, study your 6 tests. I would look over your booklet though. I think that booklet's good. The ASCP cards, I think they put them in a little nutshell and you just can read through it. You can do that. When I took my first master's, I did it at Edwardsville. I remember I had no cards in my car. I was at a stoplight, I'd pull out the no cards. So that little booklet is kind of good. So we'll meet here at 8. I'll let you look at the key and grade them. You'll see what you got, then I'll grade them. But at least you'll get to see. And, then you'll have Diane.
Oh, and red.
And then Monday, did I put out weekday schedule yet?
I don't think so.
I think because I didn't know exactly what she was doing Tuesday, Wednesday, so I'll just probably put the time and let it up to her. Monday, I know we're gonna do training in new MLT and do Barb and I's affectives. And, I'll have you evaluate both Barb and I tomorrow, so I get that done. I'm gonna do my post-test. Then Diane, I think, is gonna do her affectives on Wednesday, so the day of, before we go to Cutters, all you gotta do is,
When we turning in the binders?
what binders?
And they just-
You don't do
literally
your
like
portfolio
staple
again
it
to the
right
end
here.
of your clinical.
Oh, so it's not due to the end?
No, to the clinic, well, it'll be in December.
This is mine, I
Okay.
brought from work.
Yeah, so
I actually have that.
who did you get your book from?
Yours
Krista.
for a flimsy binder.
Then you go downward, then you can pass Lorian to Sean.
Okay.
Who has the other book?
I have it. I
Then
did
you
it.
I don't have
go,
space in my book
you
bag.
go up, then you go to
Nicole gave me this, so.
Patricia.
Okay.
Yes, Patricia.
Can I give this to the next person?
Yeah, if you wanna give it to Jen, you can give it to Jen. Okay. So thank you guys, you've been working your little butts off, I appreciate it. I appreciate it, I appreciate it, I appreciate it, I'm excited for you.